We are live. Good morning, everyone. So, welcome to the Nutritionist Corner Dialogue. And today we are going to talk about a topic that is not so central to nutrition, but it's part of nutrition because as nutritionists, we communicate with the aim of fostering behavior change. And the only way that you'll actually have someone change to what you want them to do is when they understand why they need to change, and that stems from communication. So, my name is Lilian Momina. I am a registered clinical nutritionist, and I'm also one of the co founders of the Nutritionist Corner. And today I'm joined by Grace Njogona. She's also a clinical nutritionist. I will allow her 1 minute to introduce herself. And then after that, we can introduce the topic and maybe get a little bit nuggets of why we are doing this. So I hope that we will have a very nice discussion. And if you have concerns, if you have information on how we can improve health communication in Kenya, make sure that you write it in the comment section so that you can read out and have this discussion because it's necessary, because there are gaps that we are really lagging behind when it comes to healthy information when it comes to the health sector. So Grace, karibu sana, kindly introduce yourself and tell us what you do, where we can get you, and then we can start off.
Brilliant. Asante sana, Lillian. And it is definitely an amazing privilege to be here again, to have this dialogue and be part of the conversation that really changes and shapes the future of our country. My name is Grace Njuguna. I'm a clinical nutritionist that specialized in renal nutrition. And I work physically in Nanyuki Teaching and Referral Hospital. That is where you'll find me physically in the renal unit and in the wards. But mostly, you'll also find me online when I am taking care of my own clientele via Malfa Nutrition Consultancy. And you'll also find me physically in Nanyuki town as well. On social media, this is me, Grace Njuguna, on Insta as well as Facebook. Right. So I think this is one conversation that is going to be really important because it's going to be shaping a lot in the coming years, but also to really identify the gaps that we have, just not as nutritionists, but we're also looking at it future policymakers. That is where we are headed, Lydian. You're already in that space yourself. Some of us are also growing into that space, whether at the county level or at the national level. That is where we are headed. What we want to ensure that we get to do in terms of communication and the information that we relay to the public and to our fellow country folk, and it will lead to actually amazing behavior change, and in the long run reduce the triple burden of disease that we are getting currently in the country, Lillian.
I totally agree with you. Totally agree with you. And we are definitely going to get into why we need to get involved as nutritionists and other healthcare professionals when it comes to relaying of healthcare information. But let's just frame the problem. Allow me to frame the problem. Like
Sure.
today, if you go on the ministry's website, the Ministry of Health website, or even their socials, Facebook, LinkedIn, Twitter, or even it's Twitter nowadays, you'll find that they have posted something that they want Kenyans to consume. And then in the comment section, you'll find reactions from Kenyans with very little explanation as to why those reactions are like that, or even a response from those reactions. So there's this tendency where they are not communicating as they say, they're just relaying information without the need of making people understand. And I think this has been a challenge, especially in the recent issues that we have been having. Something as important as SHA is not as taken up as it should, because people has people still have that perception that this is still a bad thing and it will harm them, because the naysayers or the other people are way louder, and they are able to get to the masses faster and easier and better than what the professionals at the ministry are doing, even both at the county and the national level. Other thing is on the quarantine thing in Nanyuki. You are based in Nanyuki, so you definitely understand that it is something that is meant to improve research, to improve management of contagious diseases and conditions. And it might be a good thing for Kenya. But unfortunately, we saw the uprising where people are saying that inakuja kutuia wazazi. People do not understand why we need to have a quarantine center in our country where we can be now tackling the the dangerous conditions that come by in the future or even now, So I think
Mhm.
from that, it's easy or it's safe to say that the ministry talks or the ministry drafts information, but Kenyans do not understand it. And that is why we need to have this conversation, because the challenge lies not just because on who is delivering the message, but how the recipient, that is a Kenyan who does not understand health, will actually take it. And from what I have gathered personally is that things that we take as simple understanding, we assume that everyone will understand in a very simple and a very easy capacity. Majority do not. Like nutrition, you would expect someone will understand when you tell them to have ugali, skuma, and egg instead of having ugali, potatoes, and something else. You would actually expect them, because it's something that looks like a common sense. Inakaa ni kitu rahisi sana. Why are you not understanding? But unfortunately, people are not wired like that. And with the loud noise of social media, Grace, now tell us where you think the ministry is going wrong. Because me, I've said that they are relaying the information wrongly. So you can just give us on theme 1, we talk about who creates the message, and because you see me, I believe that is one of the problem that we have, where we are having people in boardrooms creating the messages and such. So how does this affect how people relay information, how people consume the information, and how people translate the information?
Right. So with health communication, we have two things that are really important. We've got quality of the information being relayed, and quality I will look at the language that has been used, the tonation that has been used. We're looking at the simplicity of it, because health communication means that it is scientific first and then it is translated, right? So there's quality of, the quality of information, and then there's the quality of the relationship between the communicator and the community, right? So there are those two things. And so if we start with quality of the information, we just looked at what are the things that we're going to eat. One, we're looking at the language used. So there's no scientific jargon in there. It is simply broken down to what the public would easily understand. Number two, the tonation also used. And in the recent days, we've been able to see where tonation has not been very good. Of course, that came with backlash from the public, without
Yeah.
having to go loud on who and where and how. It is in the public domain, right? So the language used, having to translate the scientific jargon and scientific language to the common language, a language that the common Mwananchi, a grandmother living somewhere in Laikipia North, who's probably from the Kama community, would understand it Swahili. So the language, the tonation, as well as the choices versus consequences without having it being commandatory, of some sort. So that is quality of the information here in terms of communication. And then there's a quality of the relationship between the communicator and the community itself. Now, that will have a lot influence in it, of course, right? So we're talking about political issues, we're looking at attitudes, we're looking at cultural and customs, the social norms, um, perceptions, right? So all those things coming into play, right? So if we are drafting messages, even from policy development perspective, where we need public participation, dependent on the type of policy, all these things need to come into play. If we're developing a policy and then for some weird reason, one group is actually left out, that one group is one that will spread the word. In marketing, it is said that the best way of actually marketing is word of mouth, right? So if you have one team that was not involved, they will spread that they were actually not involved. So the communicator will look like they're not inclusive, right? Um, Another perfect example is when you're having a community development. I think this is went through in campus, where I would have projects being placed in, and I remember it would be said consistently: if you do not involve the community for that project so that they can own it, then we miss it out. And one of the things that has come out possibly in the last 1 year, as far as health communication is concerned, is bare minimum public participation, or, I mean, bare minimum or lack of it entirely. So that in the long run will strain the relationship between the communicator and the community that is supposed to receive this information, perceive it, interpret it, and then utilize it to influence behavior change and their decision making in the long run, Lillian. Right.
Sir, I totally agree with you. And I like the fact that you have highlighted where tonation and attitude from one of our biggest, currently the biggest influencer in the country, the number one office. I remember when the communication came out about tone, and people were really angry about it, not what he said, but how he said it. So yes, there's a lot of public mistrust in the country. And I think it's the problem that people perceive that just because they have relayed information, you're supposed to consume it and understand it and just take it up. And unfortunately, it doesn't have work that way, because you have talked about involving the community, building a relationship. You have emphasized, and I like the fact that you have emphasized on the importance of building a relationship between the communicator and the person that is supposed to receive, the recipient of the information. Because if there is the relationship is work, or it's really faulty, there will be a lot of trust issues. And we know, even in relationships, the friendships, the romantic, the work relations, when there is lack of trust, it's very hard for you to take something positively from someone you don't trust. So now we have talked about, I like the fact that you have highlighted we need to have great tone when you're communicating. Even if you're communicating the right thing to the right people, you have to show them that you are actually understanding. And I think that this issue where we are having maybe like people coming in with threats here and there to the public, that needs to stop, because that is not a good thing. And at the end of it all, we are Kenyans, we are humans, and humans are not logical creatures, we are emotional creatures. So how we are handled, how the information is passed to us, how we are talked to matters more than the message, because unfortunately most of us believe that information alone or knowledge alone is enough. And I want to take your perspective on that, because sometimes the correct information will be misunderstood, and it will be misunderstood because of maybe the things that you have said. So how can we make sure that the language that we are talking to about, the trust is put in place, and Kenyans can consume health information effectively? Because clearly we know that knowledge does not equate to behavior change. We are nutritionists, and as one of the things that we do every other day is try to impact people with knowledge so that they can influence behavior change. But you and I know that is far from enough. And why
Sure.
is it that, yeah, maybe you can marry that with the fact that we are having other people who are not maybe even in that health space coming in to talk, and there are people who are listening. Where are they listening, and where are they refusing to listen to the healthcare professionals?
Absolutely. So, in the Kenyan context, trusted health communication should look like this. One, it is definitely evidence based, right? So, evidence based means that when a Kenyan receives that information, they can possibly go to a search engine and they will find that information, right? They will possibly not understand the scientific language, behind it, but it would have been relayed in such a way when they get to go back and possibly study for themselves. We are in the era of amazing literacy. We have to accept that. That is very real. They will find that information from an evidence-based perspective, right? So one, it has to be evidence-based. Number two, it has to come with credible messengers. So credible messengers, you're talking about, Ministry of Health, because there's research. Thanks to Cambridge, there's a lot of research in our country. So it comes with credible messengers. So we're talking about Ministry of Health, the county health departments, right? We're looking at professionals, you and I, Lillian, right? And all our amazing colleagues in the country. So health professionals, yes. We normally sometimes use the religious teams, because again, majority of the masses, once a week at least, they will convene together, and that is an amazing platform to relay that information, right? It has to be respectful, Okay, so when we talk about the quality of the relationship between the communicator and the community, it has to be respectful, completely. That is non-negotiable there, right? It has to be it has to be one that is consistent, such that if an information, if I can take about us back to COVID era. I remember the CS then, Mutahi Kagwe, was very consistent with his communication, and most of us would possibly look forward to the communication from the CS at the time, not because we loved the numbers of COVID-19 being said then, but he's such an excellent communicator. Quite frankly, he's possibly one you could easily reckon with in terms of how he communicates as well. So it is, healthy for that communication should be consistent. The health messages should not be mixed, giving different reactions every single time, because then that raises questions of, well, what do you want us to trust, really? All right. It should encourage dialogue. Trusted communication here is a two-way process. It is not, one way, right? It allows for listening to the community concerns. So you have to take those into consideration. It allows for answering of questions, correcting misconceptions that have been there respectfully, and definitely that will invite feedback along the way. All right. So that is something else that has to be put into place when doing health communication. It has to be empathetic, right? It is empathetic in the more of many parents will have many questions, for example, on vaccines, but can we discuss the concerns and the evidence behind this? So it allows for that empathy into the communication. It is audience centered. Okay, audience centered. It has to take care of the audience beliefs, takes care of the audience concerns, the language, literacy level. So that means the communication done in Nairobi, for example, as a county, cannot be necessarily the same that is done in Laikipia County, taking into account the cosmopolitan concept, but also more the sub-counties. For example, I'm giving an example with my county where I work, because of the difference in terms of the literacy levels, right? It has to account for cultural practices and socioeconomic realities. Okay. Again, a communication being made in Nairobi County will not necessarily be phrased the same in Laikipia County, or even Embu County, or Samburu County, for example, or Baringo County. Those go the same message, yes, but it will be phrased differently to take care of these particular populations and their differences, from their literacy levels to their languages to their cultural practices. All right, so that has to be there as well. So again, that is what we are looking at in terms of trusted. The word here is trusted communication, Lillian.
Yeah, that one I agree. And I like the way you have broken it down. I was also learning and listening. I think you have noticed that. That was very good. And I think you've made it so clear on how we can adapt effective communication from both a county and national levels, because you have talked about the importance of contextualizing what information we are relaying to Kenyans. And one of the things that I was having a conversation with someone the other day, and they were like, the problem that we have in Kenya is not that we are having bad implementation of things or something, it's just that we have bad relaying of information. And this guy referred to the quarantine thing and SHA, and was like, the problem with our country is now, they assume that I bring in a communication expert or someone who just comes in, they talk and they leave, Ama they give, like, let's say, of course, the office of the different ministers, they have communication people, This guy was like, maybe it's about time that now we start thinking about bringing health professionals, so that we can now bring the idea of not just diversity when it comes to matters and problems that are affecting in Kenyans, but you can also bring different perception. How we talk to nutritionists, how maybe medical doctors talk to their doctors, and in a way that someone now, with this, like if you check on X, if you check on LinkedIn, if you even check on YouTube and other social media, we have creators who are healthcare professionals, people who are reaching masses, thousands of people every other day. Like on X, me, I follow a lot of doctors and a lot of nurses and clinical officers, and I'm hoping to also have nutritionists on board as well, because we are still lagging behind when it comes to being out there. And that's why I usually insist that in as much as, yes, we want to be felt, we want to be heard, we also have to show up where people are consuming information that is on the social media. So maybe you can highlight the importance of making sure that we marry the right professionals, the right information, and the right platforms. Why is it so important for us as a country? Because SHA is a good thing. I know it has its challenges. I know it has its loopholes and it needs a lot of improvement, but ideally, it's not the worst thing that can happen to a Kenyan. I am talking as a beneficiary of SHA, so I'm not marketing it if someone thinks I'm marketing it or something. It's just that I recently
Sure,
benefited
Lillian.
from
Yeah,
it.
yeah.
So I can
Mhm.
definitely vouch for it for now. But you see, for
Mm.
majority of us, even women who need the SHA, who are pregnant, you'll meet them and they'll tell you our register SHA. Reason being, they had they were not told, they had,
Yeah.
walisikia kutoka kwa jirani, walisikia kutoka kwa rafiki yake that SHA haisaidii, that hata akilipa hiyo 300 500 bado atahitajika kulipa pesa. You know,
Mhm.
that the disconnect between the facts, the reality, and what is happening. How can we use things that we already have, like professionals, medias and such? How can we use such to try and work through that? I don't know kama umepata hiyo.
Yeah, I got you.
Mm.
So one, preferably having credible messengers, we have to first identify, do we have a distorted quality of the relationship between the communicator and the community? And I think this is where I could comfortably say yes. To some degree and extent, yes, right? And this has been informed, with how information has been relayed in the last 1 year. And this is from simply a public perspective. Our normal country folk, they'll be like, no, we actually don't trust. You'll speak and get done with it and we move on with our lives. So since we can establish there is that sort of disconnect and distorted relationship between the communicator and the community, then it is very necessary to have um, health professionals who specialized in they specialize literally in health information and communication. All right. So why would they be necessary? One, they will be able to break down this communication and the information in a language that the country folk would easily pick up, and that would influence their change. We have to agree that knowledge alone is not enough. So we'll talk about that later, I am pretty sure. But the health information and communications officers here will ensure that one, the communication here is not fear-based. Okay, it is not fear based or sensational. They will ensure that it is not politically motivated per se. They will ensure that this information being relayed to the public is not judgmental. It is not stigmatizing, because that is something else that could, be picked up. It is not information that, one size fits all. Again, why? Because we are a diverse community as a country. We have so many languages, so many cultures, and that is what makes us beautiful. That is what makes us very not only beautiful but unique as a country, right? So the information relayed in Nairobi County again cannot be the same that will be relayed in the same language and context to Samburu County or to Turkana County or Marsabit counties or even the Swahili land down at the coast. They will not be the same. It could be the same message, only that it will be rephrased a little differently, and that is the purpose of the health information and communication officers. Um, these particular professionals will also ensure that it is not inconsistent, right? Or contradictory for that matter. And again, since they are able to put it out very nicely in a language people understand, respecting cultures, using amazing tonation, they will ensure it is not based on rumors or unverified claims because it is evidence based. All right. So that is the most important thing. We have to appreciate that there's that gap, but the solution is also right here. You've got health information and communication officers in play. That means it means that we can utilize them, right? We can even use community health promoters that are trained, the word is trained, that are trained to relay that information to them as well. Local radio stations that will have these officers go to the ground level and communicate that to them as well. So I think that is where I would go in terms of finding a solution to the gap that we have. Why use health professionals who can break down this information? Again, we do not want anything that is fear based. We do not want anything that's judgmental or stigmatizing, Lillian.
And I like how you have highlighted what we can use. And you see, some, as you've said, fear-based and stigmatization. We have that tendencies, or authorities from the places, authorities in Kenya have a tendency of trying to act like they want to intimidate Kenyans. And being human and the fact that we understand our constitutional rights, it becomes a problem to even listen to them after they've tried such gimmicks. And I think this is where now we can now start highlighting and trying to make sure that, because most of the time you find that the authorities intended to communicate something different, the public had something totally different. They've interpreted something totally different from what they had. The picture was totally different, and then the action was off completely from what was intended from the authorities. Now, because that happens a lot, and there are so many channels that we can use. We have social media. I like the fact that you have highlighted that we need to identify, but we also have the community. The worst thing with coming up with solutions to our existing problems is that we come up with a solution with the nearest to reach. Like, if, let's say, both solutions, because of the fact that Nairobi is the capital, people will come and discuss the issues that affect the country, either in Nairobi, either in Mombasa, because they want to go and enjoy the beach, or even Kisumu, or somewhere where there's a lot of cosmopolitanism. Unaona? So when you're discussing that, and maybe the people who are attending, you're not getting holistic representation of the whole country. Kenya is very diverse, as we have said. We have diverse cultures. We are even diverse when it comes to beliefs, in even in how we are going to take up information. There's someone who will not take information from a woman. There's someone who will not be okay being told something by a woman. So there you have to now, like, let's say the Ministry of Health, if the information is being relayed in such a community, then Dr. Luga will have to go in, not Modoni. You see, now these are some of the things that I think we are feeling as a community, because when we're talking about social media is a very good platform. We cannot ignore the fact that Kenyans, currently more than 70% of us have access to social media every other day, at least one platform, whether it's Facebook, Twitter, Instagram, or YouTube, or even LinkedIn, or other socials, TikTok and such. At least we have access to such every other day. So how do we now make sure that the social media marries with what the community is there? Because you have brought in the aspect of community health promoters, and we want them to go to the communities and talk about what we want as a national government, even a county government. Now, how do we make sure that we marry what the social media reactions have been? Because if you remember, these community health promoters will go and talk to people who might have seen the social post, or who have a reaction, or who have an opinion about the post that they have seen. So how do we make sure that that is successful? How do we use what is available to try and win? Because I think that is where we have a lot of mismatch. People ignore the reactions a lot. Like, I was going through the reactions, are easy, like when something is done on their socials, and let me tell you, they are not even responded to.
I hear you. One, I think it is important that we start putting out what is credible information, right? We have to agree that there are, um, I would say, professionals who are not in the health space still giving this information out, right? And that is very obvious. How do we cap that? That is totally now a conversation that should be taken up between the Ministry of Health and Ministry of Information, right? So that we're able to, cap down to those people who are not giving, they are not in the health space, so they could not be giving the right information. Why? Because we who are in the health space, we get licensed, all right? We have to renew our licenses. Let's just be honest. That is very true. And that means the Ministry of Health will have a list over us who are in the health space intentionally. Okay. So that means it's very easy to know, in the social media space between the Ministry of Information and Communications and Ministry of Health, those who are medics or those who are in the healthcare space do relaying that information to the public. So that it will be one in terms of social media management. But also, we have to agree that where we are at now, the last, say, 10 years, has already had a lot of damage being done. And that means there's a lot of work to do to rectify that damage. So already the beauty of this is that Ministry of Health has their own social media pages in terms of TikTok, Instagram, X, and they also relay that space there directly. So we healthcare workers have, or professionals have to ensure that we're on the same page as well from an evidence-based perspective. Now that's that is a baseline of it. That is the foundation of it. All right. So that when it comes now to the local place or the normal Mananchi who's probably in the market and they get to go through their phone to get information, it is the same information all through, right? Now, as far as community health promoters are concerned, the Ministry of Health, I am very sure they're already training them on some other things, and health information and communication, inclusive of strategies to relay this information to the community, should be part of it. Whether it's part of it or not, I may not confirm or deny that. I do not know. But that is a gap that can be taken care of by the Ministry of Health as far as the community health promoters are concerned, so that when they come to the community, when one goes online and they get to see, so this is actually the same information, they'll be like, this is actually the same information that was given to us by the CHPs, right? But it is also online, so it marries, and that in the long run will build back trust, because trust is gone. So it will build back trust between the communicator and the community by using credible messengers here. And social media is actually a credible messenger, only that, it is a tool that has been used both ways. And we have to agree the last 10 years has probably seen a lot of damage in it, but it doesn't mean that it's not salvageable. It is. Lilian.
I like that. I like that a lot. I like that a lot. And I think now we can discuss kidogo on how to repair it, because you have highlighted that we need to bring in the social media, make sure that it is married with what the community health promoters are being talked to and what they talk to the communities. Because you see, and now here we talk about capacity. And I think this is where we were discussing. This is a discussion we had maybe for like 10 minutes to argue to small issues here and there. Now on capacity, how to understand and relay information. I'm not saying that it's something that someone has to have gone to school. Of course, you have to have learned. But unfortunately, nowadays, we are so much into AI. And I think the fact that the AI is being fed so much by maybe other regions or other uh, continents, we might not be getting responses that actually marry with what our people believe. You'll correct me if I'm wrong, but I believe that is what is happening. So you'll find that a community health promoter or someone has been picked, they have been trained, and they have been told, or even a healthcare professional, they have been told this is what you need to go and communicate to communities, and then they are not given a standardized message. As you have said, if that message that is online does not marry with what the community health promoter or even the health professional that is going to communicate to their communities actually now talks to them about, then it becomes a problem. So in
Mhm.
ensuring that we build that trust, I think we need to make sure that we onboard not just the message, we onboard the community, we onboard the consumer who is a Kenyan. It's I would like a situation where people take communication or health information seriously, but unfortunately in Kenya, the way information is relayed, as you have said, there's a lot of mistrust, and rebuilding it, people assume that now when they come, they're given gases, they're given mattresses, whatever they're given, whatever will actually help rebuild the relationship. But people tend to forget the fact that in as much as they think logically or they have gotten a logic framework to actually now help with restoring the relationship, at the end of it all, we remain human. And we will remember. And small triggers like this, we will capitalize on them. Yes, we forget so many other things, but the fact that whatever you say, the dates that we come in, like you see, everything's really okay. From whatever was happening in June 25th, 2024, everything during the year is okay. Then June things comes to, they start becoming chaotic because we remember. And how do we now heal? Instead of trying to mask what we have observed for the last like few years, people try to mask and assume that there's no problem. They try to force people to buy whatever they want. And that, I think, in as much as leadership or whatever we are trying to do might favor for that kind of actions, it might not work in the long run because it will not help repair the damaged relationship. So I think, as you have highlighted, we need to bring in the medias that we have. We need to capitalize on the social media that you have said. We need to make sure that they marry with whatever the community health promoters are actually talking about. And then after that, we need to send health information specialists or even health communications on the ground to evaluate the understandings. Because if they have been communicated and the understanding, the interpretation has been totally different, then you're not trying to do anything. So when we send these people on the ground to try and now engage with the community after the relaying of the information, the problem with that is that we react. Like we will have a problem, then we will send maybe information for one day, then we will leave it at that. We will not
Yeah.
follow up to see what happened next, what went right, what went wrong, what can we improve, what can we borrow. That is the biggest problem that we have as a country. So I think that brings the aspect of consistency. How well are we bringing this information? How well are we making sure that we are consistently communicating the right information in the right tone, the right attitude to the community, so that people can build and start believing in us as even like leaders or even health as a community, or even the community, the healthcare professionals community. And of course, we also need to understand where Kenyans are coming from. Like for instance, like this, the recent quarantine station, because that is the most recent, most rejected thing. Of course, we have other small problems like UHC and there, but nationally, that was one of the most reacted to thing that has been happening in the ministry in the last like 3 months. Now, people actually rejected it without even understanding the need, or understanding whether it's good or bad. I'm not saying it's good or I'm not saying it's bad, but I'm just saying Kenyans reacted because after it was communicated, unfortunately, it was leaked. So people now associate the national officials with secrets that can harm Kenyans. And now that's a
Mhm.
big thing. And instead of trying to work on that, we come in and bulldoze and say that it is our way or our way. So that now brings the problems that, yes, they are hiding secrets that want to harm us, and they are forcing harm on us as Kenyans. And of course, we will react to that. So I think moving forward, we need to come with a clear channel. And this is where now we are going to talk about from creating the information now to positive action. How you have talked about rebuilding trust. How do we have models on how trustworthy communication would look like? Do we have involvement of the public enough? Do we even have involvement of nutritionists, leave alone the public, the common wananchi. We have professionals who are never represented in those boardroom, in those discussions. What is the impact? How does this impact the community? How does this impact the information? And do we listen? Are we listening to Kenyans? Are we sending people to just talk and disappear? Are we getting feedback? Are we getting rooms on grounds of improvement? So kindly share, because now we need to make sure that we are not just talking about ineffective communication. We bring the aspect on how to make sure that our health communication improves, and moving forward strategies that we can talk and can work with as a nation. Right?
Absolutely. Um, the first thing is that we have to accept, with the recent happenings, the truth is public participation has been barely there. That's a thing. So moving forward, public participation is mandatory as far as any form of health communication or information is concerned. And health information can look like policies in terms of developing their frameworks as well. That is mandatory to have the public participation come on board. Now, the reason this is because the people who are trying to develop all these communication strategies, whether they're policy, that get to really inform the future of our country, they will be able to pick perspectives from different communities, perspectives from different cultural norms, and marry them into that policy framework so that it will be all inclusive. All right. And then that also ensures that there's consistency. The problem right now is that we have inconsistency, right? So we want to establish consistency, but then there's a lot of work to be done way before that. We have to allow for public participation, we have to allow for feedback. All right. And I think where we are at right now, it is important that that capacity is built for the healthcare, the healthcare workers as well, the healthcare professionals from the national level all the way to the county level, because it cannot be, my highway or the highway. It has to be, what do you think we should do? Okay. The reason why there was a reaction with, the quarantine concept around here is there was no public participation. Truth be told, there was no public participation, right? If the community was sat down and they were like, so these are the pros, these are the cons, do you still want to have this done here? Because, I mean, rightfully so, those who are going to be around the place where that was supposed to be established are people that get to interact with the community. They're actually part of the community, right? Were they allowed to actually give their own feedback on top of that? So we have to accept that where we are at right now, rectifying and building that trust back means that political interference has to be on a low, on a huge low. But in the season where we are in, Lillian, right now, the next, say, 1 year, political interference might be inevitable. Okay. So we have to ensure that there is also consistency in terms of appreciating and empathizing with cultural norms, putting them somewhere there, something that is acceptable, right? Trusted, coming from trusted messengers as well. That is something else that is mandatory. If it's not coming from trusted messengers, that simply breaks and distorts the quality of the relationship between the communicator and community further down, right? Recently, there's now the conversation around SHA moving to Taifa Care purely and all that. We should ask, is the public aware of this? Right? Or is it something that's been bombarded on us? All right. So between the shift between Shire and Taifa Care, was there communication in the middle to say, hey, so this is what it's gonna look like the next 1 year? We'll be shifting from, the Shire portal to Taifa Care purely, where it will help to, medics do notes, medics um in terms of everything, billing, etc., so that everything is on your phone. You, as the patient, for example, you can pick your phone and say, oh, so this is what happened, this is what was found. And it really leaves the health information with the patient because they can access it. Is the public aware of this? Right. So the what does it also mean? Is our information safe as far as Taifa Care is concerned? Has there been communication in here between the SHA and Taifa Care movement right here? Is the public aware of it? Or they will simply be told, now SHA, we are no longer using the SHA portal. You're moving to Taifa Care and you need to update your details to this level. Is it simply telling them this is what you have to do and we move on swiftly? There must be public participation at every level that is going to be utilized in our country. And that is health, mark you. Is the information safe? Can I access it? Is it easy for me to keep my own medical history? Right? Because I feel like that is where this is needs to go. But has it been communicated to the public and to our fellow country folk? That is where we are going. Let me scale down to nutrition. Where I work, when we started moving from the half plate concept of half plate with quarter carbs and quarter protein, all right, and moving to low carb for most of our patients and being able to walk with them the journey entirely, there's still a number of them that have been left behind because they didn't show up to clinics, right? And communicating the change needed to come from an evidence based. So we'll communicate. Now, research has shown if we get to do this, you'll have amazing improvement of your glucose level. Your sugars level will improve. And until they started seeing the results, is when they started trusting that what we're telling them is actually true, right? But we have to tell them this is research, this is what it has shown, and it has shown for many people, and the research was done for 5 years. You can actually look it up, particularly for the literate folk. And they were able to see that evidence, and it has been embraced. But it needed time and patience into it and working with them. All right. So that's a consistency again, working with them until they were able to embrace that change completely. Are we ready to do that? Are we ready to walk in consistency? Are we ready to be patient until we are able to appreciate behavior change and behavior change that is embraced and reminded to the country folk consistently? So all these things have to be embraced. We have to embrace them for us to have consistent, excellent, and empathetic healthcare information and communication, Lillian.
That is very good. And I like the example that you have given about the change in models in our plate, because there are still places where the former model is still very much in use. And
Mhm.
if you try and talk otherwise, you're told maneno ya social media na maneno ya ground haziwezi kuwa same. Now, because of the literacy age and the social media era, of course, the noise is very loud. You cannot compare to the past. The past, where we used to have extension officers or healthcare professionals, even community health workers or community health assistants, being the ones that are going to avail information to communities where they will gather them, they will put them in places, and then they will communicate, but unfortunately they will not care about how it was received or whether it was interpreted well or not. That was a gap that has been consistent up to date. So I hope that we are actually hoping that this conversation triggers or actually helps healthcare professionals, policymakers, and even curators of health information to actually now
Mm.
rethink of how we shape, how we come up with, and how we communicate and relay information. Now, because of that, I want us to think about, you have talked about the consistency and you've talked about the importance of understanding that things change and behavior change, because nutrition, I think I usually tell people we are the cadre that begs people to change for their own good, not for our good, for their own sake.
Mm.
We beg them, we tell them. Now, we know as professionals, we know that getting to that point, people are completely okay with leaving whatever they had normalized behind and moving forward with what the evidence, what the research says, what the
Mm.
good practices actually encourage is not a walk in the park. How can
True.
we make sure that the information that is packaged kutoka pale the national offices is packaged well enough for the consumer, it is communicated right, it is relayed After communication, it has to be relayed. It is received and interpreted right. And after that, it is consistently communicated or given reminders. Because not
Mm,
everyone is going to those meetings. You'll find that, let's say, a ward or even a community with maybe 5,000 people, and when the
mhm,
CHP call a meeting, only 100 people show up. And unfortunately, they'll go back and communicate what they understood,
mhm,
not what you talked about. So how do
mm,
we now bridge that gap? Because I think this is where we are failing most. Your consistency in bridging the gap, or even what sometimes the national office, the boardroom solutions, as we call them, they come up with
mm,
solutions. They are aired on national TVs, and then they disappear. The next one is another communication. That communication for yesterday, you may share up,
mhm,
or the next day another communication, and they continue the information that they are releasing one at a time. And the worst thing about the social era is that you will still find people who will capitalize. Let's say a communication was done at 9 a.m. You'll find TikTokers when you wameongelelea hiyo kitu from 9 to 12 midnight. So in reality, even you as a consumer, you're more likely to come across the TikToker who has repeatedly consumed and done TikToks on the same communique than whatever was communicated. And if this TikToker did not understand the concept that was supposed to be communicated, that is what majority will actually understand. This you can actually check in this comment section, because let's say, for example, something like HIV. The other day, data were showed up, ukasema Nairobi. Then the TikTokers were like, no, it's not Nairobi. It's just like people are saying that ni venye Nairobi watu ni wengi, so people assume that, oh, blah, 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 wanaonea Nairobi, oh, blah, blah, blah. And it was supported by a lot of Nairobians, me being one of them, because he had insisted on that, the fact that these people wanaonea Nairobi, si Nairobi ni watu wanaonewa.
mm,
And the same thing, we have this Nairobi, wote tunashare hiyo. It's still the same Nairobi, but we are still refusing to accept that it can actually come from behaviors and patterns and actions that we have normalized as a county, but
mm.
tunakataa. So I think how we're going to overcome that challenge, because I think that's one of the biggest challenges that we have. How people receive, how people relay, and how people interpret information. You have talked about consistency, but how is it going to be packaged? How can we make it consistent? Because I think I believe kuambia to CHPs is not enough. Honestly, that's my belief. It's not enough. Mhm.
The biggest tool right now we have, Lillian, is the concept of social media, right? So that means the consistency here has to be applied to use a tool that will allow for consistency. Um, One of the things that I know will always influence health information and health communication is the cost attached. All right. So we have to find tools that are cost effective and they will relay that information consistently. All right. So social media is one of them. Of course, if you're finding a TikToker who's investing more than 6 hours into TikTok, it's because, of course, they earn from it. But most importantly, it's because they get to relay some form of information to them. So why don't we do the exact same thing? Only that we have to do it consistently to build back that trust. Now, while relaying this information, it has to be packaged for different people. Like I said, we will not have the same consumption of information in Nairobi being the same in Turkana County. Let's just be honest. That will not necessarily be possible. It will not also be possible for the same in Wajir County. So we have to ensure that the packaging is suitable for the targeted audience. Okay. So, what audience are we taking care of? Right? What language will we use? What tonation will we use? Okay. So, all those have to be in place. We have to use tools that are cost effective and that will make consistency not easy but doable. Okay. I wouldn't use the word easy in this case. Doable is something that can be done. Even if we say we make targets of once a week or once every 2 weeks, that is going to be there. Let me give you a perfect example. And of course, it's because a lot of money goes into such campaigns. the malaria campaign, for example, and during the rainy seasons, you might have noticed in the recent years, not so much has gone into it because malaria has now amazing research and even the vaccine is now being taken care of. But in the, in the past years, say from 2019 backwards, all the way to 2009, during the rainy season, you'd find consistent communications and campaigns use mosquito nets. Right now, we've got mosquito repellents in terms of bombs, but during then, mosquito nets were a thing. So there was a whole campaign in terms of communicating it, and it was consistent, right? So why don't we do the same? If we go to major, the big media houses, it might be very costly for the MOH, Ministry of Health, but then if they invest in their own TikTok accounts, their Instagram accounts, or their websites to make these communications consistent, then I think we'll be able to build back that relationship and building back to one that is actually trusted. That is where the major gap is. Are we making use of the tools that we have that are cost effective, and can we establish consistency? It simply means that we have to be intentional, right? And then the other thing that's very crucial is capacity building. Can we have health professionals who are trained in health information and communication purely doing this? Because automatically it will mean that they will be very sensitive to the different cultures, they'll be very sensitive to the social norms, they will also be very sensitive to the political environment we are in. So that said, it means, of course, the one oath they will always ensure that they do not break is do no harm, right? It is part of the oath that we take when we commit to taking care of humans for the rest of our lives is do no harm. So they are already in a covenant of whatever I get to do, this information has to be purely for the benefit of the communities that we get to have. Yeah.
I like that fact. I like the fact that you have emphasized on having healthcare professionals. I think they should. And I think this is where someone said that we should have health champions. And health champions, what better way to have them than trained healthcare professionals? Because it's also a niche the Ministry of Health can explore because wameshindwa kututafutia kazi. So they can have health champions where they have the different cadres. We want involvement. We don't want people who are talking about food and they are not nutritionists. We will come for them because it's a regulated cadre. I don't want to go and talk about pharmacy because I'm not a pharmacist and it's a regulated cadre. I also don't want to see a random Kenyan talking about medication and how to self-prescribe on X or even on TikTok, and they are not regulated, because at the end of the day, we have to adhere to the protection of the common mwananchi. So I think the fact that you have emphasized on consistency and the way it's packaged for different people, I think we can also use the vernacular TV stations because our biggest problem is the information is relayed in English and Swahili. We assume that every Kenyan will speak Swahili. I know they are the national languages, and I know it is what that is nationally used in Kenya for training and education and many other things. So we will assume that everyone or a majority of us can speak Swahili, but we still have a gap that is not able to. And the CBC imetoa, kitambo people used to be trained, ukiwa ushago unatrainiwa from class 1 to class 3 in vernacular language. I think the CBC has removed that. It has scrapped that off. So they're trying to, as much as they can, to make sure that we are all universal when it comes to understanding. But before we get to there, of course, there are vernacular languages that would actually be easier to use. So the ministry can also do that. And we also need to talk to the media. They emphasize on what they deem popular or the people that they deem popular. And yes, of course, some media houses, as we call, they have been bought. I'm just quoting, I don't know. They have been bought by some people. They have been compromised. So they might not relay the information as it is. They might not relay the reactions on the ground as it is, because they are told not to show, because the international community is watching. We fail to remember that Kenyans are watching. and we are the consumer and we are the recipients of this information. So I think the fact that we fear, as a country, we fear so much about what the other jirani anaangalia, and we are not taking care of how we are at home, it becomes a problem. So I think that is very okay. And of course, we need to make sure you have insisted on the capacity building. As healthcare professionals, ours might be to treat, to prevent, and to take care of Kenyans. But of course, we need to also understand how to communicate. And one of the things that we have observed at the Nutritionist Corner is that anytime we have a webinar on support skills, things like communication skills, things like leadership, things like emotional intelligence, things that actually influence how you talk to people and how you relate to people, our professionals turn out in very low numbers, because I think we have that engraved in our mind that ours ni medical jargons, yetu ni kutibu tu, I think we also need to have a shift, a mindset shift, where we are actually now normalizing that this should be part of the professional development, the CPDs. We should have communication, we should have leadership, we should have management, we should have emotional intelligence, we should have listening skills, we should have things as simple as maybe creating a message for your community, public speaking.
Yeah.
Or we should actually make sure that we normalize them as part of the CPDs, and this will actually now create interest. And then in the long run, we have them being part of the professional development or even the specialization, like the way we have nutritionists. We can also have health information nutritionist. I'm a information specialist who's a nutritionist, or information specialist who is a nurse, who is a clinical officer, who is a medical officer, who's a pharmacist, who's a dentist, who's a healthcare records person. So I think we need to try as much as we can to do that. And I don't know, Grace, because I have talked, it's already 1 hour, and the shughuli that you're supposed to do. So I think you will give us a parting shot. Please make sure that you leave your concerns, your comments in the comment section. I promise you we will get back to you, even if not now, but because we need to have a continuity of this conversation. We need now to address how to now relay our information. I think, Grace, you'll come back and we can continue this conversation if you don't mind,
I don't
because
mind.
we have highlighted the problem, we have highlighted the gaps, we have brought in the solutions. Now, what are we going to do moving forward to make sure that the solutions are actually now implemented? That is something that we need to also have a conversation on. And I think we will definitely love to host you again for that, so that we talk about that. I've written it down, so I will definitely request you in the near future. So I think we need to have that. And moving forward as healthcare professionals, let's not get so angry when we see reactions from Kenyans, because I used to get angry when I would see someone not understanding simple information. We also need to understand that people have different understanding capacity. And sometimes, no matter how good you think your communication is, it's not getting to people that they are getting. People might be having a lot of stress. As you say, they might be having a lot of public mistrust. They might be having a lot of mistrust when it comes to the healthcare workers, the healthcare professionals. Wanasema ati wanakuja kuwadungia watoto wa ukufe. Ile polio campaigns ya last year where I live, and majority of people here are literate. I'm telling you, even kupeana consent shule ilikuwa shida. Like, it was a problem, which is, it's quite sad, but it's the reality of the matter. If people do not understand the need, if they do not understand the importance, whatever you're trying to get them to onboard, they will not actually onboard it. So, Grace, you can share with us a parting shot, what you think we should be doing moving forward, alafu we can call it a day.
Brilliant. So my parting shot is this. There is a lot of work to be done. There's a lot of damage to be undone as far as health information and communication to our country folk is concerned. And that means we have to start thinking about rebuilding the trust between we, the communicators, and our communities. Let's package our messages in such a way that they'll be taken up. But also let us be consistent. Let us be respectful. Let it be audience specific. And I know we moving into the political year, very heavy in the long run. Let it be that all the form of communication we'll be making is for the benefit of the country folk from your inner hearts. Ensure that the communication you make, health information that you relay, and how when you communicate it, let it be that it is to the benefit of our country folk from wherever it is, from the far corners of our country. Ensure that it is to the benefit of our country folk. This is me, Grace Njuguna. I'm out.
Thank you so much. Thank you so much, Grace, for joining us. And moving forward, when you come across this as a healthcare professional, please just think about how to change how information is relayed and received in your country, in Kenya and in Africa, because there's a gap. I'm sure Kenya is not the only country. In fact, according to other East African countries, we're doing really, really well because we are allowed to react to some national conversations. So I think moving forward, we need to understand that this is a communication. This is a part that this should actually make part and baseline of what the policymakers are doing. We should not be making or improving policies without having the inputs that we have discussed today. So thank you so much, Grace, from the Nutritionist Corner Dialogue. Allow me to sign out. I was your host, Lilian Mumina, the clinical nutritionist, as I said, and one of the Nutritionist Corner founder. So make sure that you follow us on all our platforms. We are on LinkedIn, we are on YouTube, we are on Twitter. No, we're not on X. We are on Facebook, not yet. We are on Insta, and you're definitely on TikTok. Make sure that you check us out, and let's grow a community where we lead, we transform, and we impact Kenyans positively. So thank you so much for watching, and we will see you on the next discussion. Bye.